All right. Well, good afternoon, everyone. Thank you for being here this afternoon. What we're going to talk about is, in my eyes, really, really important. My 4 words: kids, taxes, agriculture, values, and what we're here to talk about is protecting our kids. I think developments in since the first of the year is really, really important for everybody to understand what's happening with measles. Measles is mumps and measles. I'm old enough to remember how everybody got mumps and measles when I was a kid in the 60s. We've been using the same exact vaccine to protect kids since 1971, same exact vaccine. And you might say, well, why are we talking about it today? Well, we're talking about it today because since the pandemic, and there's been a decrease in the number of kids being vaccinated with measles. It's really important for everybody to understand that why we have the same vaccine that we've had since 1971 is because this virus doesn't change. Flu vaccines change because the virus changes. And so it's incredibly important, and for a period of time, it hasn't been eradicated, but virtually non-existent. So why are we talking about it today? Because since the first of the year, state of Texas has over 540 cases. They've had 2 kids die. It migrated into New Mexico, migrated into Oklahoma, and it's now in Kansas. So my saying is, virus always wins. It's not if it's going to come to Nebraska, but when, and that's why we're here. So the goal from my seat is simply to make sure that people understand the difference with this virus. It doesn't change how important it is that you have your children vaccinated against measles. This virus, you will have the virus and spread the virus for 10 days before you get sick. So this virus can live in an environment for over 2 days. So the wins. If you're not vaccinated, you're going to get measles. Low probability, but 540 cases in Texas, 2 children have passed. I think that we can do just like we have when we have tornadoes. Incredible tornadoes, nobody dies. If we are proactive and preventative, we can make an incredible difference. So I'm really, really proud of the people behind me. We started talking about this about 3 weeks ago, and I'm really, really proud to introduce Dr. Sydney Stein. She's our Department of Health and Human Service epidemiologist. I'd love to visit with Sydney because as a pig veterinarian, I really thought I was an epidemiologist, but we'll get the expert here now, Dr. Stein. Thank you.
Thank you, Governor. Good afternoon. Measles is the most contagious virus that we know to infect humans. And to put this into perspective, 9 out of every 10 people who are exposed to measles and do not have immunity are expected to become infected. Measles infection is a serious disease that can lead to severe complications, including death. Those who are most at risk are young children, pregnant women, and those with weakened immune systems. Measles spreads easily through the air when an infected person breathes, coughs, or sneezes, and it can stay infectious on surfaces and in the air for up to 2 hours after someone who's sick with measles has been in this space. Therefore, people can become exposed without even realizing that they have been in contact with an individual with measles, and they can spread it before they know that they are ill with more than just a common cold. Symptoms of measles include tiredness, runny nose, cough, pink eye, and that is followed typically within 2 to 4 days by a rash. Although measles is typically considered a childhood disease, it can be contracted and cause serious illness at any age. As Governor Pillen mentioned, measles cases are on the rise across the United States. While numbers of measles cases are changing daily, we are aware of at least 750 confirmed cases across 24 states. The majority of those cases are occurring in Texas, New Mexico, and Kansas, and at least 79 people have been hospitalized. Tragically, as the governor mentioned, there have been 3 deaths, 2 in children. The current increase in cases is overwhelmingly due to expanding outbreaks among undervaccinated communities, but ongoing measles transmission worldwide continues to be a risk for travelers that are not immune. I'd like to emphasize that the measles, mumps, and rubella vaccine is safe and remains our best protection against measles infection. If you have not been vaccinated already or are interested in receiving the MMR vaccine, we encourage you to reach out to your healthcare provider or your local health department who can help you to find a vaccination clinic near you. If you're unsure of you or your child's vaccination status, also check with your healthcare provider. Now to talk a little bit about what we are doing at the state to prepare for a measles response. We are and will continue to work closely with our local health departments, healthcare providers, and other stakeholders to share updates and best practices regarding the prevention, testing, and management of measles. Our local health departments can answer questions about MMR recommendations and help interested Nebraskans find those locations for vaccination. We're also working with these local health departments to prepare for increased vaccination efforts in their jurisdictions if needed. We are also coordinating with our healthcare providers to identify best practices to minimize exposures at their facilities and help to coordinate testing. If a measles case is detected in Nebraska, you can expect that we at DHHS and the local health departments will release information on potential public exposure locations and times. We will support local health departments, staff in their case investigations, and ensure that people know how to protect themselves and their loved ones, and offer exposed persons preventative services and testing if needed. Again, there are currently no confirmed measles cases in Nebraska, but just one case at a school, airport, or shopping center could lead to dozens or even hundreds of exposures, and preventing cases is everybody's goal. I'll now turn it over to Dr. Tesmer.
Good afternoon, everyone, and thank you, Governor Pillen and Dr. Stein. Okay, what I'd like to go over a little bit is just what to do if you suspect measles. If you think that you or your family or one of your family members are having symptoms of measles, isolate from others and call your health care provider, the emergency room or urgent care, before, and I emphasize the word before, arriving to be tested. Unless it's an emergency, do not arrive at a healthcare facility without giving advance notice. And the reason behind this is that providers need to prepare for the arrival to avoid unnecessary exposures in waiting rooms or lobbies. Of the importance of vaccination, the best way to protect you or your family against measles and other vaccine-preventable diseases is by immunization. The MMR vaccine is very safe and effective. One dose is effective 93% against measles. 2 doses are 97% effective. This vaccine has been used for decades and has an excellent safety record. Routinely, children should receive their first dose of measles vaccine between 12 and 15 months of age, and the second dose between 4 and 6 years of age. If there's going to be planned international travel or travel to an outbreak area, children ages 6 months to 11 months should receive an early dose of the MMR vaccine. 95% of the community must have immunity against measles to stop an outbreak. That's what's called herd immunity. If you are unsure of you or your children's vaccination status, please reach out to your health care provider and ask. For folks whose primary care providers use the Nebraska State Immunization Information System, otherwise known as NESIS, they can securely download the personal or your child's immunization information to your Android or iOS mobile device to confirm that. Measles is a preventable disease. Without vaccination, it can spread quick and dangerously. If you're interested in receiving the MMR vaccination for either yourself or your children, again, please reach out to your healthcare provider or your local health department. Thank you.
Thank you, Dr. Stein and Dr. Tesmer. Also want to thank Charity Menifee and Steve Corsi, Department of Health and Human Services, for being here and having everybody working together as a team for the people in Nebraska. So with that, we take any questions. Yes, sir.
So you kind of touched on it in your opening remarks, Governor. How concerned are healthcare providers and DHHS with the rise in vaccine hesitancy after the COVID-19 pandemic?
The question is, how concerned are we with the decrease in since COVID with COVID? So that's why we're here, right? Because there's been a decrease in vaccination since because of what took place during COVID, and this is a vaccine, as Secretary Kennedy, I think, recently has said as well. This is a vaccine that's really appropriate. There's no question. There's no gray. We have to have herd immunity. You get herd immunity by vaccine so that it doesn't pop up. So that's why we're here, trying to make sure that folks that have said, hey, all this vaccine stuff, this one is for real. This one's a big deal. It makes a difference. And it's just really simple. People need to understand it's because this virus doesn't change. And this virus is the same as it was back when I was a kid, and the vaccine's been the same since 1971. So that's a pretty good track record. And I think the other that everybody on this team's been working on it. I mean, think about Sydney, 540 confirmed cases in Texas roughly? And there's been two babies die. That's too many.
Do you have an idea about what percentage of the Nebraska population is currently vaccinated against measles and where that stands now versus, say, 5-10 years ago?
Yep, go ahead.
So the question was, do we know what the current vaccination rate coverage is for MMR? And those numbers are a little bit difficult to know across the entire population, but we do track this annually among kids that are entering school, so kindergarten, first grade, and our 7th graders. And we have seen a decline into just over 94% across the entire state for that school entry level immunization rate for MMR specifically. It's higher for our 7th graders, closer to 97%. So that's encouraging that children are kind of getting caught up on that 2 doses. But again, we do encourage that the public, if for some reason you have gotten behind on getting your children their 2 doses of MMR, if you've been hesitant to get it, just thinking that we don't have a risk, now is the time. Now is when we can do prevention against measles, not when we have an ongoing outbreak. That can be a little bit too late for some people if you get exposed and you don't have immunity. So we really want to encourage people, now's the time to get those vaccines caught up.
Thank you, Dr. Stein. And maybe one to add to it, this is a really important topic that we don't go by opinions and adjectives, that we go by the data and the specifics, and the data and the facts and the truth. And I think that there's another that across the board, I think vaccination rates have dropped like 3%. So, that's a number that starts getting us under the herd immunity level, which is really problematic. Andrew?
You have the Easter season coming on, a lot of people traveling. I mean, is there any concern, or what kind of procedures should people take if you're going to travel?
The question was, what kind of precautions should individuals take if they're going to be traveling for the upcoming holiday season? Again, we encourage you to make sure that you and your family are appropriately up to date on your MMR vaccination, checking with your provider, looking at NESIS if your provider happens to report into there for your vaccination records. International travel right now is risky. There are many countries around the world that are experiencing measles outbreaks, including Canada and Mexico, and we have multiple states here in the United States that have ongoing transmission. So if any of those areas are going to be traveled to, we would recommend that you be immunized or consider not traveling there if you have a child that's too young or you happen to be in one of those at-risk groups that cannot be vaccinated, such as pregnant women and severely immunocompromised people.
So if I'm vaccinated, can I go over there, or do I bring it back?
There's always a small risk. Again, we know that the MMR vaccination efficacy is extremely high. While there are occasional breakthrough infections, it is rare, and individuals that are fully vaccinated and have an infection with measles tend to have much more mild illness and be less infectious to those around them. So again, we would recommend caution with traveling to areas that are experiencing an outbreak, even if you are immunized, but especially if you cannot be fully immunized or cannot receive the vaccination for health concerns.
Dr. Osaki, that was a fabulous question, by golly. That was impressive. Any other questions? Yes, sir.
You kind of touched on it, but say like, you're not traveling. Is there anything else you can do just being here in Nebraska? And maybe if your children are too young to be vaccinated, what you should do for what you can do for them?
Yeah, so the question is if, so we can be, a child can be vaccinated as early as, and maternal antibodies hold off, protect the kids.
Yeah, most children that are under the age of 6 months do have maternal antibodies for measles as long as their mother was vaccinated, and so that should offer some protection. We do, however, we are not currently recommending that anyone under 12 months of age receive an early dose of MMR for those in Nebraska, unless, again, you are traveling internationally or to a domestic area that's experiencing an outbreak. One thing that is just good practice, no matter what disease we're talking about, if you are sick, we urge you to stay at home. Don't spread your germs. Again, measles does not present with a rash at the beginning. It looks very much like any other common cold that your kid might pick up at school or daycare. So if your child is ill, I know that it can sometimes be hard to do this, but we recommend keeping them at home. Don't let them go and expose others. And if you are concerned about measles or another infectious disease in your child, let your healthcare provider know. Give them a call before you come in if you suspect measles so that we can try to decrease any potential exposures to other members of the public that might be in that same healthcare facility.
And while you're up, what happens if you get an exposure, especially in a school? I mean, how will that be handled? Will everybody be quarantined, or will just the people not vaccinated be quarantined?
So no matter where the exposure might have taken place, we will work with the local health department to interview the patient or their parents, if it happens to be a child, to know where they traveled when they might have been infectious to others. When we have names of direct contacts, the local health department will reach out individually. So you may get contacted individually by your health department if we have a case detection. If there are exposures in public places, we will again put out those press releases with the locations and the times that somebody might have come into contact with measles. There will be a mechanism for you to self-report that exposure, and then you'll be followed up with by your local health department. In a school setting, we would certainly be double checking vaccination records with any students that might have been exposed or faculty. And unfortunately, children that do not have evidence of immunity will be asked to stay home for 21 days for symptom monitoring. So again, we urge even one dose of MMR vaccination, and we can do not as invasive of needing you to stay home. You can still go about your day and we'll do symptom follow-up. But if there's no evidence of immunity, we'll ask you to stay home for up to 3 weeks.
Go ahead.
Yeah, so in other viruses, we talk about once you get it, the virus itself, you're immune. Is that the same with measles? So if you've had it in the past and maybe you weren't vaccinated, do you still have immunity, or should you also consider getting the vaccine even if you've had the virus and the
Yeah, so I had measles as a kid. I've got immunity. I don't have to worry about it. And that's where most adults have all been exposed or been vaccinated. So the immunity, there's an exception to everything, but adults don't have to worry about it. And that's why it's really, there's things that you can ask a lot of questions, but those answers are all speculation. The big message today is really, really simple. If you have children that aren't vaccinated, let's get vaccinated, because that's what makes the biggest difference. Go ahead.
I'll expand on that just a little bit. So anyone who was born prior to 1957 is expected to have naturally attained immunity because measles was circulating at very high rates back then. The vaccine was introduced in the early 1960s, and so anybody after that point typically is considered to be immune if you have had 2 doses. However, even adults that were previously immunized, if you are undergoing some kind of medical issue or taking certain medications that cause severe immunocompromise, you could still be at risk for developing measles even if you've been vaccinated. So again, we do ask that part of asking the entire community to be vaccinated helps protect those among us that can't be. And so this is really something you do not just for yourself, but your family and your community.
Give that to them.
One other feature of measles that we would like to call out, there are severe consequences for getting measles infection in some individuals. Not every individual will have severe illness. However, one feature of getting a measles infection naturally is that the virus itself infects the memory immune cells in the body. So it can essentially take somebody, whether they're a child or an adult, who has previously developed protections against all manner of infectious pathogens and wipe that immunity away, which leaves the person at increased susceptibility for other infections besides measles. And so again, we highly encourage vaccination as a way to obtain immunity if you were born after 1957.
Dr. Osaki?
This can be a politically charged, topic. You could have just let the health department handle this. Why did you want to come out in front of this?
Oh gosh, a really, really simple question. Kids are really important. We want to make sure all kids are protected no matter what the issue is. This is an important issue, and the data is crystal clear. Number of people doing vaccinations has decreased. This one's a no-brainer. This virus vaccine works. This virus protects our kids, and there were 2 kids that have died in Texas. Don't want that on my watch here. We can make a difference by coming out and making it happen. The more we all talk, together we can, together we will. Yes, sir.
You kind of alluded to the together we can. Nebraskans, they help Nebraskans, right? They're a big community. So I think you just touch on it again, how important this is, not just for you or your kid, but we're Nebraskans helping Nebraskans by getting this vaccine.
Yeah, exactly. It's simply exactly the point that if you can protect your family by getting your children vaccinated. You get your children vaccinated, that's what you can control. And the more of us that are vaccinated, there's not going to be the virus out shedding. The key is getting our children vaccinated. I think the other key that Dr. Tesmer brought up is if you think you're sick, don't go to the doctor. Call the doctor. They'll tell you to get them a swab and that you stay out so you don't infect other people. That's a really important piece as well.
I guess one last question for me is for the health professionals here. With other viruses, we think when it spreads, it has a chance to mutate. Is there at all concern if there's not herd immunity with this virus that it can mutate and the vaccine at some point may be less effective? Or is that not something we're worried about?
Well, as a veterinary health professional, no.
Measles has been around for a really long time, and thus far, it has not mutated. The vaccine that was first licensed around 1971 is effective for measles. Unlike, as was stated, the flu, influenza, which can mutate, measles has not. So we know we have the tool to prevent measles and prevent its spread.
I think that's a really awesome question to end things on, because that's the key of the message. This virus does not mutate, and that's why the vaccine is so effective. All right. Thank you all for being here. Kudos to our team. Really grateful for all your work. Thank you very much. All right.